morning, everybody out there. You did say I could sort of take off the pieces and still be respectful. Dean Curran, family, faculty, friends, and graduates. I'm truly honored to be invited to give this address as a Rollins alum. Now, have no fear. I was here about a decade ago, sitting right over there. And I realize your foremost desire of a speaker is brevity. For those of you who have not been in Atlanta before, can I get the hands up? New people? Yeah, there's a reason we call it Hot Atlanta. And when the dean invited me to give this talk, he specifically asked me to give a memorable speech in 10 minutes or less. So no pressure there. So I quickly sort of scraped my idea. I was thinking of, a war and peace-like speech, tracing the noble history of public health in 16,000 BC, as we went from hunters and gatherers to an agrarian society. But I knew that was going to put you in a coma and probably have a couple of you pass out by the time I was done. So instead, what I'm going to do is hopefully short and sweet, memorable, that'll address you, the audience, and hopefully my dean. He may actually invite me back again one day. Now, I assume many of you are recovering from a premature celebration last night or anticipating a well-deserved celebration tonight. But I'll bet 20 years from now, nobody in this audience will remember who your commencement speakers was. With that in mind, I've sort of made it my challenge. Don't remember who I am. It's really irrelevant. What I do want to do is leave you with one memorable piece of advice from this commencement, and that is I want you to go forth and continue to do what many of you have already started to do, which is ask the unasked question. And let me frame it for you in a way that most of you will recognize right away. So let's look at global health statistics. The United States ranks only 33rd for the lowest infant mortality rate in the world, and similarly only 29th for life expectancy. Now, this is in spite of the fact that we supposedly have the best medical care globally. We definitely pay the most for it, as most of you know, twice as much as persons compared to other nations. So now some of you in this audience are going to be asking, well, how's that possible? And for the other 98%, give me a minute here. And it's because we're the only high-income country that doesn't ensure all of our citizens have some type of medical coverage to get the care they need. So while clearly we're not the healthiest nation in the world, the national debate currently is focused on, cutting costs by limiting coverage to the neediest, whether it's constitutional to require mandates for individual coverage, and death panels. So that seems to be what we're spending a lot of our time discussing. And I believe we're really focused on the solutions to the wrong question. So right now, everybody's asking, how do I cure this disease? Instead, what we should be asking is, how do we prevent disease? And I believe prevention is the emerging public health issue of today and for our society. So I'm going to urge each of you graduates here, as you begin your journey in public health, step back sometimes from the daily grind of what we need to get done and challenge yourself to ask the unasked question. You have an amazing class of graduates who are already asking and answering the right questions about how to prevent disease and promote health both here and worldwide. And this includes Lisa Condas. Lisa, you out there somewhere? I'm going to embarrass you publicly. Who was in Jamkhed, India, assisting mobile health teams in the Comprehensive Rural Health Project with adolescent health initiatives and microfinance sustainability during his village visits. So Albert Einstein once said, learn from yesterday, live for today, hope for tomorrow. The important thing is not to stop questioning. I'm going to take this one step further and challenge all of you to not just stop questioning, but also to ask the right question and demand the same in the answers throughout your journey. Graduate Becca Egner. Becca, you out there somewhere? Oh, she's out there. Took this step coordinating health services for over 200 Bhutanese refugees throughout the Grady system here in Atlanta. She was also able to catapult a refugee women's sewing group to greater success by negotiating here with the Emory's Barnes & Nobles to sell their hand-sewn products. And I'm going to be careful. There's 315 people sitting here. You all have accomplishments, and it's going to be really long. So maybe just one or two more. Now, as you move forward in your careers, knowing many of you have a certain career path in mind, be open. You may actually be surprised where journey may take you. So let me use myself as an example. I did not expect to be in public health. I always imagined that I'd be a doctor, practicing medicine, probably teaching some interns back in New York City, which is my hometown. New Yorkers out there? Yeah, all right. And can you believe it? I'm still here in the South. Okay. It was a mentor at the University of Michigan where I did my residency training who led me to public health and CDC's Epidemic Intelligence Service. And so following his advice, I came here to CDC and began my career as a disease detective and really began what I thought was the best 2 years of my life. I got to travel to Russia, did a nice study with kids using a new influenza vaccine that they squirted up their nose. I did a nice outbreak of food poisoning on a cruise ship in Hawaii, which your professor Christine Moe was here in the faculty somewhere, one of the first papers I ever wrote at CDC. And I identified a common gut virus as a cause of a cluster of a bunch of dizzy people in Thermopolis, Wyoming. So who would have ever thought, yes, dizziness is associated with the viral illness. Now, beginning work in public health, I realized there was a whole science to public health that I really wasn't prepared for just coming right out of med school in my residency. So I completed my MPH right here at Rollins and began a wonderful, challenging, and rewarding career in public health. And I can tell you without a doubt, this additional education was invaluable to me, and I'm very confident the same will hold true for all of you here today. I once had to decide for the WHO whether we were going to resume smallpox vaccination in Zaire for a monkeypox outbreak that we're having based on something called the basic reproductive number. Now, for those of you who sort of slept through those classes, this basic reproductive number decides whether or not a disease is going to be a pandemic going from person to person to person. So as I sweated out those calculations, I was really hoping that, thinking about the fact that maybe I shouldn't have slept through some of that FP2 methods classes. This related outbreak and other things really changed our thinking and helped us lead to a fundamental question, which is, what would we do in the United States in a global community if smallpox, this devastating disease that we only eradicated in the 1970s, would ever return, especially since very few of us have immunity anymore. So thanks to somebody who asked that unasked question, we now have enough vaccine to protect the whole population in the United States and many within our global community. Now, as I said, my initial intention was to stay at CDC for only 2 years, and I already had a fellowship lined up to go back home. Instead, I decided to ask the unasked question, how do we ensure the health security of our nation from unexpected and unpredictable public health threats? So 20-odd years later, I'm still here, can't imagine doing anything else. So the moral of my story is, had I not been open to this new path and decided to ask the unasked question, I wouldn't be here today. So although I want you all to have goals, please begin your journey with open minds. You never know where you may embark upon an opportunity that really will change what you were planning to do. So ask the right questions, demand the right answers, take chances, and you may find yourself in places you could not possibly dream of today, including, well, in my case, it was Atlanta, in your place, and maybe somewhere else. Now, this extends to Andy Thornton and the many other members of the Student Outbreak Response Team. Andy, you out there? And what about the other members of the Student Outbreak Response Team? We have a couple more of you here. All right, I got a lot of hands up there. This is a team that works very closely with CDC during public health emergencies and are really invaluable to me and many of our staff at the agency when we activate our National Public Health Operations Center. This included the recent devastating outbreak in Haiti and the subsequent cholera outbreak. That didn't just involve these students, but involved many Emory alum and faculty members for us. So all of them have been helping to ask the unasked question, how do we improve prevention and identify new strategies to protect and promote health? Okay, I see a lot of people fanning themselves, so let me leave. That was sort of going to be my sort of criteria, depending on how many people are fanning, I'm going to stop. You can always find some stopping point. Yeah, a lot fanning faster? Okay. 2 final thoughts in order to meet the dean's, 10-minute deadline. Okay, so the first is a little bit of whimsy for the graduates. And I'm going to share something from Dr. Seuss, which from all the places you will go. I'm sure many of you in this audience know these lines. You have brains in your head, you have feet in your shoes. You can steer yourself in any direction you choose. You're on your own, and you know what you know. You are the guy and gal who will decide where to go. Now, what I'd rather refer you to after this little bit of whimsy are the words of Robert Frost in The Road Not Taken. As you decide, with these brains in your head and these shoes in your shoes, where you're going to go. And in that poem, when he comes upon two roads that diverged in the yellow wood, he had to choose between the well-trodden road or the one that was grassy and wanted wear. He goes on to say, and both that morning equally lay, in leaves no step had trodden black. Oh, I kept the first for another day. Yet knowing how way leads on way, I doubted if I should ever come back. I shall be telling this with a sigh, somewhere ages and ages hence, two roads diverged in a wood, and I took the one less traveled by, and that has made all the difference. And finally, I'd like to give a shout out to all the parents, spouses, and other loved ones of the graduates. So a little, yeah, they're worth that. I want to make a special note to the parents of Grishma Kharad and Meredith Kanego, who have been my epidemiology fellows for the past year. I know they're both out there. And also Kate Black and Christine Liao, who also have been working in our Center's policy office. This is, for the parents out there, this is not a coincidence. We have a lot of connections back and forth between CDC and here at the School of Public Health. And I'm looking forward to seeing many of these graduates actually walk in the halls of CDC over the next couple of months as they start their new careers. So these graduates, so I want to just sort of tip my hat to you, which I took off already, but I took it off for you parents and spouses and loved ones. These young men and women are already asking the critical questions about public health and how do we improve public health. And I'm going to challenge them to continue to go on and asking those unasked questions. Remember, the one thing 20 years from now, unasked questions. Okay, thank you and congratulations to all of you.